The parents of a 5-year-old self-identified African-American boy bring him to the outpatient allergy clinic for a routine health maintenance and prevention visit. 6 months ago, the patient experienced an episode of severe generalized urticaria, lip swelling, and mild expiratory wheezing within 20 minutes of consuming peanut butter at a family gathering. Okay, so that sentence alone tells me that this kid probably has an allergy to peanuts, and so this is actually would be defined as anaphylaxis, and it's the temporal relationship between developing anaphylaxis and there being some kind of a allergen tells us that that is a clear allergy and should be avoided in the future. The reaction resolved completely in the emergency department following emergency medical treatment. So it's likely that the kid was able to receive epinephrine and all the supportive steroids and treatments within time to prevent the progression of the anaphylaxis. And it was relatively serious given that he had to go to the emergency department. Subsequent diagnostic testing confirmed a severe immunoglobulin E-mediated hypersensitivity to peanut proteins. So that sort of puts it as a perfect diagnosis here that he got tested for it and he has the IgE-mediated hypersensitivity to it. So he definitely has a peanut allergy. Since that time, the family has strictly avoided all peanut-containing foods, and the child has remained completely asymptomatic. The patient is prepared to enroll in a new full-day kindergarten program next month. He has no other medical conditions and takes no daily medications. On physical exam, the patient is active and alert, no acute distress. His temperature is 97.9, heart rate is 92, respiratory rate is 18, blood pressure is 96/60. Skin exam reveals no active rashes, wheals, or cutaneous abnormalities. Cardiopulmonary exam demonstrates a normal rhythm without murmurs and completely clear symmetric breath sounds, bilaterally without wheezing or stridor. The remainder of the physical exam is entirely normal. Which of the following is the most appropriate next step in management? So otherwise, this kid is presenting as well appearing, and it looks like all we have to work with here is that he has this history of peanut allergies that has been confirmed through allergy testing. And so next best step in management, let's go through these answer choices. Provision of an auto-injectable epinephrine prescription for the school nurse. So it's actually a good idea to have this because we know that he has had anaphylaxis to a peanut exposure in the past. So if he's going to school, and this is one of those anticipatory guidance kind of health maintenance kind of questions, having access to epi at a reasonable distance and time is the most appropriate next step because it would prevent him from having really bad anaphylaxis in the case that he was exposed to it while in school. So I definitely like that answer choice B. Recommendation for an inpatient double-blind oral food challenge. Again, since we know he's been tested for it and the history is pretty convincing, it doesn't really make sense to do another challenge test to sort of see if he's allergic. It wouldn't add more information or help with the management. Scheduling for screening repeat skin prick testing assignment. Again, this wouldn't make sense either. You would try to assess him for having an allergy that has been confirmed already. Would not help his going down the line in any way, shape, or form. Standard prescription of daily oral second-gen antihistamines. So for this would make sense if you're worried about some kind of like a skin reaction, like hives or urticaria or anything like that. But for the management of anaphylaxis, the use of antihistamines really is not appropriate. You need epinephrine on board as soon as possible. And so for that reason, D isn't correct either. Up titration of inhaled low-dose maintenance corticosteroid. This would be something you would do if the kid has asthma and is sort of like a daily medication to help with bronchial hypersensitivity reactions and bronchoconstriction, and that would be reasonable if he had asthma, right? But we know that this reaction that he had was likely anaphylaxis due to peanut proteins, and so the most appropriate answer here is A, having access to the epinephrine. And so there's two big pillars for a patient that has had an anaphylactic reaction is A, avoid the allergen, and then B, have access to epinephrine at all times. And so for a kid, he might not be able to carry it in his backpack all the time or know how to administer it, which is why it's important that it's brought to the school and it's with the school nurse so that it's easily accessible. And for those reasons, A is the right answer.